Hello and welcome. If you have been told it's time to start dialysis, you may be feeling overwhelmed, maybe even scared. And that's completely normal. I'm Dr. Santosh, a nephrologist. And today I'll help you understand exactly how to prepare for dialysis step by step and how you can still live well and even enjoy your life while on treatment. So let's walk this path together. You are not alone. For this, let us understand what is dialysis. We'll go to part 1. Let's start with the basics. What exactly is dialysis? There are two main types. One is hemodialysis, where blood is filtered through a machine and it removes the waste and extra fluid from your body. This is usually done in a dialysis center in a hospital about 3 times a week. Each session lasts for around 4 hours. And there is another dialysis known as peritoneal dialysis, which is done at home. In this, you put a special fluid in your belly through a soft tube and it gently draws out the toxins, and usually it is done daily. You or a caregiver is required for doing this procedure at home. Now we will help you choose what works best for you, for your body, your lifestyle and your comfort between these two dialysis types. Let's go to part 2. Let's plan early. We require some access or AV fistula for dialysis. So if you're going through hemodialysis or planning for hemodialysis, you will likely need a AV fistula. It's like an adapter in hand. It safely connects your body to the dialysis machine. We do a small surgery in hand, usually on your arm, and it connects an artery to a vein, making it stronger. It's the safest and most durable access, and it's much better than catheters. Catheters are more prone for infection, but there is a very important part. It needs 6 to 12 weeks to mature. So plan early, don't wait for a crisis. For peritoneal dialysis, we put a small catheter in your tummy through which the fluid will be exchanged. Vaccination. We have to protect ourselves. The CKD reduces our immunity and we are prone for a lot of infections. The routine vaccines which are given is hepatitis B, pneumococcal vaccines, flu shots. These 3 vaccines are routinely done to prevent infections in dialysis and CKD patients. We'll take care of all the details. You will never have to do this alone, and we'll share the schedule for this. Now let's talk about your mindset. Many patients tell me, "Doctor, I'm so scared." And I always say, it's okay to be scared, but don't let this fear stop you from living. Dialysis is not a punishment. It's actually a lifeline. It's a tool to help you feel better, think clearer, and return to things what you love. Here are a few tips that helps you. Visit a dialysis center before you begin. It eases the fear. Bring music, books, or a tablet to pass the time during dialysis. Talk to other patients, and there are some support groups online available. Always remember, you are in control of your life. Let's go to next part. So what gets better with dialysis? So now for the good news, dialysis doesn't just help you survive, it helps you feel better, more energy, you will feel less tired and less foggy, improves appetite, food may taste good again to you, clearer thinking, fewer toxins and sharper mind will be there, less swelling in the feet, legs and face, easier breathing. With extra fluid removed in dialysis, you will have better breathing. Better sleep. Your sleep will be deeper, more restful, and the nights will be better. Most importantly, you may feel hopeful again. So how is the life on dialysis? Dialysis is not the end of the joy. Many people feel stronger and happier once they start, and you can still return to work or school. You can travel. Yes, travel is possible with planning. Dialysis is possible in other cities, and some companies like Nephrologist offer dialysis holidays also. Exercise, walking, yoga, even dancing can be done. Enjoy your favorite food in moderation with guidance of a nephrologist. And we are here to help you build that. Now my final message is, if you are preparing for dialysis, start early, ask questions to your nephrologist, take care of your body and your mind. You can still live a full, meaningful life. Don't be afraid to hope. Don't be afraid to smile. Dialysis is a part of your story, but it's far from the whole story. If this video helped you, please share it with someone who may need support too. And don't forget to like, subscribe for more patient-focused kidney care tips. Stay strong, stay informed, and stay hopeful.